This is Dr. Kenneth Ellenbogen, and I'm here in New Orleans at our annual Heart Rhythm Society meetings. And I'm pleased to talk to you about a paper that's online in the Journal of the American College of Cardiology. It is a large, retrospective, cohort-based study comparing CRT to conduction system pacing. The size of this number of patients studied is over 1,700 patients. About half are randomized to conduction system pacing. About half were randomized to traditional CRT with a coronary sinus lead. The primary endpoint was either death or heart failure hospitalization. Now, you wouldn't be surprised to hear that conduction system pacing resulted in a significantly narrower QRS than patients who had CRT. But the take-home message from this study, and again, I encourage you to go online at JACC and look at the study because it really is a huge study. It's a multinational study. We have patients from all over the world. But the endpoint shows that patients who had conduction system pacing had a lower primary endpoint than patients who had CRT. So as we've heard at our annual meeting, with a paper from Dr. Romero in JACC-EP, and this paper from Dr. Vijay Raman, myself, and a whole host of contributing authors all over the world, both of our studies are fairly similar. Now, of course, our sample size is huge, over 1,700 patients, but both argue that conduction system pacing is associated with a lower primary endpoint of heart failure or death. And again, this was driven primarily by heart failure, as in Dr. Romero's study. Thank you.